Welcome to Module 4 of our Asbestos Awareness course. In this module, we will discuss the health effects of asbestos. I want to start our discussion with a short video of how asbestos affects the lungs.
Asbestos is a fibrous mineral that's resistant to chemicals and heat, and very tough. It was also added to the building materials of many older homes. As a worker or homeowner, the hazard exists when undertaking a renovation or demolition. The danger is releasing the asbestos fibers into the air. When a worker breathes, asbestos fibers enter the mouth and nose and flow down the air passages deep into the lungs. The fibers lodge in the delicate lung tissue where oxygen is absorbed into the blood. Immune system cells try and break down the asbestos fibers and become damaged and die. Scar tissue forms around the dead cells and spreads as more fibers embed in the lungs. Asbestos fibers can remain in the lungs for long periods, and the scar tissue that results continues to develop for many years after exposure. Eventually, so much scar tissue develops that the lungs stop working.
So asbestos fibers embed themselves in the lungs and are attacked by the body's defenses. Here we see a microscopic view of the asbestos fibers and the lungs' reaction. So what damage comes from that attack on the lungs? Most of us already know that asbestos causes lung cancer, but there are several other diseases and conditions that it causes, such as mesothelioma, asbestosis, pleural plaques, and pleural effusion. We will discuss these in turn. While asbestos does cause lung cancer, it usually only does so after prolonged exposure. However, if the exposures are high enough, cancer can result after just a year of exposure. Cancer has even been seen in the families of asbestos workers, despite the fact that family members never worked with the material themselves. The cancer does not develop immediately, though. It usually does not occur for 20 to 30 years after exposure. It is also insidious, often not showing any symptoms until it is well developed and difficult to treat. Several factors affect your risk of developing lung cancer from asbestos. The obvious first one is the amount of asbestos you breathe in and for how long. Given the long latency period, the time between your exposure is a factor, as is your age. As we mentioned in Module 2, some types of asbestos, like crucidolite, are more harmful than others. And lastly, there is smoking, which we will discuss in a few moments. Delving into our next asbestos-related disease, I want first to talk about the pleura. So what is a pleura when it's at home? The pleura is a set of two layers of thin tissue that cover the lungs and the inner wall of the chest cavity. They are lubricated by a small amount of pleural fluid, which allows the layers to move over each other easily. This minimizes friction as the chest expands and contracts during breathing. A mesothelioma is an aggressive and usually fatal cancer of the pleura. It is almost always associated with exposure to asbestos, either through work or simply close contact with an asbestos worker. Like lung cancer, mesothelioma has a long latency period of 16 to up to 60 years. As I stated a few slides ago, smoking affects your risk of lung cancer. In fact, smokers regularly exposed to asbestos are 50 to 100 times more likely to develop lung cancer. On the positive side, if a smoker quits, their lung cancer risk can be cut in half. And also positive, smoking does not appear to affect the risk of mesothelioma. Asbestos also has effects beyond cancer. It can cause pleural plaques, which are localized deposits of protein within the pleura, or pleural effusion, which is a buildup of fluid within the pleura, even pleural thickening and fibrosis. These conditions affect between 10 and 60% of asbestos workers. And lastly, there is the disease which bears its name, asbestosis. This is a chronic lung disease caused by the buildup of scar tissue in the lungs. The scar tissue, just like a bad scar on your skin, is rigid and makes breathing difficult. On an X-ray, asbestosis can show small spots in the middle or lower lungs where the X-rays cannot penetrate the thick scar tissue. This image shows a healthy lung on the left and a lung with asbestosis on the right. Shortness of breath, sometimes severe, is a common symptom of asbestosis, as is cough, chest pain, reduced lung function, and a bluish tinge to the skin. While asbestosis may take several years to develop, it is fatal in 20 to 40% of the cases. And that concludes our discussion of the health effects of asbestos. I invite you now to move on to Module 5, where we will explore some issues related to handling asbestos.